Hi, horse friends. Today we're going to talk about one of the most painful and potentially life-threatening muscle conditions that horses can experience, a condition commonly known as tying up. If you've ever been riding and suddenly felt your horse become stiff, reluctant to move, or seem like they were developing colic, there's a chance that what you are actually seeing was the early stages of tying up. The frightening part is that many horse owners don't recognize the warning signs until the condition has become severe. In the early stages, a horse may simply feel a little sluggish or unwilling to go forward. Some riders assume their horse is being lazy, stubborn, or simply having an off day. But pushing a horse through those early warning signs can dramatically worsen muscle damage. Today, we're going to discuss what tying up actually is, why it happens, which horses are most at risk, the earliest warning signs that every horse owner should recognize, what you should and should not do if it happens, and how veterinarians diagnose it. We're also going to discuss how you can reduce your horse's chances of experiencing another episode. As always, we're not veterinarians, and this video is for educational purposes only. If you suspect your horse is tying up, contact your veterinarian immediately. So let's get started. The term tying up has been used for generations in the horse world. While the names have changed over the years, they all describe the same basic problem. Muscle fibers become damaged during or shortly after exercise. When muscle cells are injured, they begin breaking apart and releasing their contents into the bloodstream. Those damaged muscle cells released enzymes like creatine kinase, commonly called CK, and AST, which veterinarians measure on blood tests. In severe cases, the muscles also release myoglobin, a muscle protein that can damage the kidney if enough of it enters the bloodstream. This is why severe episodes of tying up can become true medical emergencies. Many people assume tying up is simply sore muscles after exercise. It isn't. Imagine running a marathon and suddenly experiencing severe muscle cramps so painful you can barely stand. Now imagine those muscles continuing to break down internally. That's much closer to what a horse is experiencing. One reason tying up is sometimes mistaken for colic is because affected horses often appear uncomfortable. They may paw the ground, look at their sides, sweat excessively, breathe rapidly, and refuse to move. Without looking closely at the muscles themselves, it's easy to confuse these two conditions. The difference is that horses with tying up usually have extremely painful muscles, especially across the hindquarters, loin, and back. One of the earliest clues many riders notice is that their horse simply doesn't feel normal. Maybe the horse suddenly loses impulsion. Maybe he starts taking unusually short strides. Maybe he feels stiff through his hind end. Maybe he doesn't want to transition into the next gait. Sometimes the horse stops altogether and simply refuses to move forward. Those are moments that deserve your attention. One of the biggest mistakes people make is assuming the horse simply needs to be pushing through it. Unfortunately, if the horse is actually tying up, continuing to exercise can significantly increase muscle damage. As the condition progresses, additional signs often become obvious. The horse may begin sweating heavily despite doing only moderate work. His breathing becomes faster, his heart rate increases, the muscles over the hindquarters may feel unusually firm or almost rock hard. Some horses develop visible muscle tremors. Others stand with their hind legs tucked underneath them because moving is simply too painful. You may even notice that the horse appears to be walking on eggshells, taking tiny, careful steps because every movement hurts. One particularly important sign occurs after the horse urinates. Normal urine should be yellow, but if enough muscle damage has occurred, the urine becomes reddish-brown or even resembles coffee. That discoloration is caused by myoglobin leaving the damaged cells and entering the urine. It is one of the strongest indications that significant muscle injury has occurred and should always be treated as an emergency. Now let's talk about why horses tie up in the first place. This is where things become a little more complicated. Many years ago, people believed tying up was caused almost entirely by lactic acid buildup. We know that's only a small part of the much larger picture now. There isn't just one cause. Instead, there are multiple pathways that can all lead to muscle injury. For some horses, overexertion is enough. Imagine a horse that's been standing in a pasture for several weeks and then suddenly asked to perform an intense workout. His muscles simply aren't coordinated for that workload. Other horses develop tying up after inconsistent exercise schedules. For example, a horse that receives several days off but continues eating a high-energy diet may become more susceptible when work resumes. Heat stress also plays a role. When horses exercise in hot, humid weather, they lose tremendous amounts of water and electrolytes through sweat. If those losses become significant, normal muscle function can be disrupted, increasing the risk of muscle injury. Some horses, however, have underlying muscle disorders that make them much more prone to repeated episodes. One of the most well-known is PSSM, or polysaccharide storage myopathy. These horses have abnormalities involving how their muscles store or utilize glycogen, the stored form of sugar that muscles use for energy. Certain breeds, particularly quarter horses, draft breeds, and some warm bloods are more commonly affected. Another condition is recurrent exertion rhabdomyolysis, often abbreviated RER. Unlike PSSM, RER appears to involve abnormalities in calcium regulation within muscle cells. Thoroughbreds, standardbreds, and some high-strung performance horses appear to be overrepresented. Interestingly, many horses with RER seem completely normal between episodes, making diagnosis challenging until multiple events occur. Temperament may even play a role. Highly anxious or excitable horses sometimes appear more prone to recurrent episodes, likely because stress influences muscle physiology. That's why maintaining a consistent routine often becomes part of long-term management. So what should you do if you think your horse is tying up? First, stop exercising immediately. Don't ask for one more lap. Don't try to finish the lesson. Don't insist your horse just needs to work through it. Continuing exercise may worsen muscle injury dramatically. Next, call your veterinarian. While you're waiting, keep your horse as calm and quiet as possible. One of the biggest myths in the horse world is that you should walk a horse through tying up. Years ago, that advice was common. Today, we know that's generally the wrong approach. Forcing painful muscles to continue working may create additional muscle damage. Instead, allow the horse to stand quietly wherever it is safe to do so. If moving is absolutely necessary for safety, move the horse as little as possible. And, if practical, trailer the horse rather than walking a long distance. Offer fresh water. If your veterinarian has previously instructed you regarding electrolyte supplementation, follow those directions. Otherwise, plain water is perfectly appropriate while you wait. Try to keep your horse calm. Stress itself may worsen some forms of tying up, so reducing excitement is beneficial. If it's cold outside, a blanket over the hindquarters may help keep muscles warm. If it's extremely hot, gentle cooling with water can be appropriate. Contrary to an old myth, cooling muscles with cold water does not trigger additional cramping. There are also several things you should avoid. Don't massage the painful muscles. Although it seems logical to rub sore muscles, heavily damaged muscle tissue is extremely painful, and vigorous massage may only increase discomfort. Don't administer medications unless your veterinarian specifically instructs you to do so. Pain medications may complicate evaluation or place additional stress on organs depending on the individual situation. Once again, don't force the horse to keep walking. When your veterinarian arrives, they will begin by performing a physical examination. Heart rate, respiratory rate, hydration, muscle tenderness, and temperature all provide valuable information. Blood samples are commonly collected to measure CK and AST. CK rises very quickly after muscle damage and often peaks within hours. AST rises more slowly but remains elevated longer. Together, these enzymes help determine the severity of muscle injury and monitor recovery. Your veterinarian may also evaluate urine color and kidney function if significant muscle breakdown is suspected. In horses, additional diagnostics may become necessary. Genetic testing for PSSM may be recommended. Other horses may undergo muscle biopsy or additional metabolic testing if recurrent episodes continue without an obvious explanation. Fortunately, many horses recover completely from a single tying up episode. Recovery depends on severity. Mild cases may improve within a few days. More severe cases often require intravenous fluids, pain management, anti-inflammatory medications, careful monitoring of kidney function, and several weeks of controlled rehabilitation. Returning to work too quickly is one of the biggest mistakes owners can make. Even though a horse may appear comfortable after several days, muscle fibers are still healing. A carefully designed rehabilitation program helps prevent another episode before those muscles are fully recovered. Prevention is really where horse owners can make the biggest difference. One of the most important strategies is consistency. Horses generally tolerate regular exercise much better than inconsistent schedule of hard work followed by prolonged rest. If your horse receives several days off, it's often appropriate to adjust feed accordingly rather than continuing a high-calorie ration designed for heavy exercise. Conditioning also matters. Gradually increasing workload allows muscles to adapt safely. Sudden increases in intensity are far more likely to trigger problems than steady progression. Hydration should never be overlooked. Performance horses lose tremendous amounts of sweat during exercise. Providing continuous access to clean water and working with your veterinarian on an appropriate electrolyte program during periods of heavy sweating can support muscle function. Nutrition also deserves careful attention. Different forms of tying up require different dietary approaches. For example, many horses diagnosed with PSSM benefit from diets specifically designed to reduce starch while providing calories from fat sources instead. Those dietary decisions should always be made alongside your veterinarian or an equine nutritionist, because what works for one type of muscle disorder may not be appropriate for another. Environmental management can also help. Reducing stress during travel, maintaining predictable exercise schedules, avoiding unnecessary excitement, and providing adequate turnout all contribute to healthier muscle function in many horses. One thing I think is particularly important for horse owners is learning their own horse's normal way of moving. You know your horse better than anyone else. If your horse suddenly feels different under saddle, don't ignore that feeling. Many riders later say they knew something wasn't right during the first few minutes of the ride. The horse just didn't feel like himself. Sometimes those subtle changes are the earliest clues that something much more serious is developing. Listening to your horse and stopping early may prevent a mild episode from becoming a major medical emergency. Fortunately, research over the past several decades has dramatically improved our understanding of tying up. We now recognize that it's not one single disease, but a collection of muscle disorders with multiple causes. We understand far more about genetics, nutrition, conditioning, and long-term management than horse owners did a generation ago. That knowledge has allowed many horses that once would have repeatedly tied up to continue successful athletic careers through careful management and individualized care. The most important takeaway from today's video is this. If your horse suddenly becomes stiff, reluctant to move, develops painful hindquarter muscles, begins sweating excessively, or simply feels dramatically different during exercise, don't assume it's laziness or poor behavior. Stop working. Call your veterinarian. Early recognition may dramatically reduce the amount of muscle damage and improve your horse's recovery. Because when it comes to tying up, recognizing those first subtle warning signs may be one of the most important things you'll ever learn as a horse owner. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing. Also, remember, we are not veterinarians, and this is just our guidelines and our suggestions. Thank you so much.